Over the past few years, something interesting has happened. More and more people are starting to question what they were told about COVID vaccines. And currently, the internet is awash with conspiracy theories. But when they question what they were told about COVID vaccines, it's not just the policies, but the fundamentals. Did they work? Were we misled? And is there still data we're not being shown? Now, today I'm reacting to a video featuring Clare Craig that was on John Campbell's podcast. And I want to do this properly, not by dismissing what she's said, but by asking a simple question. Do her conclusions match the evidence? Because many of John Campbell's videos are always conspiratorial and rarely factually accurate. But as always here, we don't assume institutions are always right either, and we don't assume critics are always wrong. But we do slow things down and look carefully at what's being claimed. Now, the first point of her talk is the vaccines didn't work. So let's start with that central claim. The vaccines didn't work. They couldn't have worked. And people who said that were silenced. Now, that's not a small claim. That's a complete reframing of the actual pandemic. So before we go any further, we need to define what worked actually means. Vaccines were never designed to stop all infection or eliminate transmission completely. They were designed to reduce severe illness, reduce hospitalization, and reduce death. And across multiple countries, that's exactly what we saw. Lower hospitalization, lower ICU, HDU admissions, lower mortality, particularly in vulnerable groups. If they truly didn't work, we wouldn't see any difference between vaccinated and unvaccinated populations, which is contrary to what these conspiracy theorists like John Campbell, etc., claim. But we did. Now, the idea that people were silenced, there is some truth in there with what Claire says. Debate was constrained at the time. That isn't the same as saying that no criticism existed, because it did. So the next point she makes is about Omicron and misleading claims. Now, the argument shifts. Omicron was mild. Vaccines didn't change that. The people were misled. That's always the general consensus from these people. So yes, Omicron was less severe than earlier variants. That is 100% true. But again, that's only part of the story. They put lies in truths to make them more palatable. By the time Omicron arrived, millions of people had been vaccinated. Millions of people had had the infection or prior strain of the infection. Population immunity changed, as it does in these situations. So when severity dropped, it wasn't just the virus, it was also the immunity that met it head on. You can't separate the variant from the immunity that was already there. You can't. So even during Omicron waves, using Omicron as an example, because that's one she uses in her book, we still saw lower hospitalization, lower severe outcomes, lower death, déjà vu, in vaccinated groups. Now, was this always communicated clearly? No. The messages from the government did not always keep up with the nuance. And that matters. Working in infection control, we were repeatedly giving changing advice on a day-to-day basis. It was very frustrating. Now, she also goes on about what if there were no vaccines? That's a really important question. What would have happened without vaccines? Who knows? But here's the reality. You don't get to run history twice. So people can make conjecture, but they can't prove any of it. How can you? We can't replay the same pandemic without vaccination and then compare outcomes. It's all theoretical. So everything here that she talks about, the modelling and observation, is still just an estimate in her opinion. There's no evidence to back it up. Now, on the point about extreme promises, that is fair. That is fair. Some messaging, a lot of messaging, was overly optimistic a lot of the time. Expectation and reality didn't always line up at all. But this leap that if vaccines worked, the pandemic would have ended is absolute crap. And it doesn't follow at all. At all. Vaccines don't need to eliminate a virus to have been effective. It's amazing that these people actually work in the medical profession. Vaccines reduce harm. They reduce pressure on healthcare systems. Effectiveness is not the same as eradication. And yes, many vaccinated people did still get COVID. But the real question is, what happened when they did get COVID? And that's a question she doesn't ask. Now, were COVID deaths overcounted? This is one of the most serious claims, that COVID deaths were being misclassified at scale. But here's the reality. People don't usually die from just one thing. As a nurse of more than 20 years, I know this to be true. They have underlying conditions, multiple health issues or conditions, and then they might get an infection as well because they might have been in hospital for a long time, for argument's sake, or exposed to something. Death is rarely a single event, is what I'm trying to say. It's a chain. Quite often it's a chain. And when clinicians record deaths, they include the underlying cause and any contributing factors, and the death certificate is split up into sections accordingly. So if COVID triggers deterioration, it can legitimately be part of the cause of death. That follows. With and from are not opposites, they overlap. Now here's the key point. If COVID deaths were massively overstated, as Claire claims, we wouldn't see a rise in overall mortality. But we did. And she doesn't justify that. We saw significant increases, which she doesn't justify, across multiple countries, which she doesn't justify. You can debate classification until the cows come home, but you can't ignore the rise in deaths. And they need to be justified if you're going to make these claims. Now, the video goes on a lot longer, but across all of this, a pattern emerges in the video. Each argument contains a real question, a real concern. But as is so often with John Campbell's videos and his guests, then a much stronger conclusion, a false conclusion, is built on top of it when the foundation is very shaky evidence. Yes, vaccines had risks. That is true. That doesn't mean they didn't work. Yes, messaging was far from perfect, sometimes appalling. And that doesn't mean everything was false. Yes, data is complex. Evidence is complex. That doesn't mean it's being hidden. The danger isn't asking the questions, ever. We should always be worried if we run out of questions, not run out of answers. But the danger is accepting conclusions without holding them to the same standard of evidence that we expect for everything else. We can acknowledge uncertainty, mistakes, imperfect communication. You could go on. They're all things we can acknowledge. You don't need to and shouldn't jump to everything was wrong, therefore nothing can be trusted. Because that just doesn't hold water. Once we do that, we stop analysing the evidence and we just start choosing sides. And that's all you see on social media now. People are just ignoring the evidence and drawing their own conclusions. And when that happens, the truth doesn't disappear. It just becomes harder to see. And that is why I keep doing these videos and having these conversations, because it's really important to keep the truth and the facts in plain sight.